Hello, everyone. Welcome to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the Dean at the Arizona College of Podiatric Medicine and host of the Dean's Chat podcast. For the next few months, we're going to be doing bonus episodes on Dean's Chat, and we're going to release them every Friday. We want to highlight students from each of the schools and colleges of podiatric medicine. Today, we have 4 students representing the Samuel Merritt University College of Podiatric Medicine. All 4 are members of the American Podiatric Medical Students Association, otherwise known as the APMSA. I'd like to introduce each of our guests individually. First, from the class of 2024, Ms. Raisa Chiri Zarzosa. Welcome, Raisa.
Thank you, Dr. Jensen.
And Miko Fogarty from the class of 2025.
Thank you for having me.
Well, you're welcome, Miko. From the class of 2026, Nicolette Medrano. Welcome.
Thank you so much, Dr. Jensen.
You're welcome. And also from the class of 2026, Dayron Hernandez. Welcome, Dayron.
Thank you, Dr. Jensen.
You know, one of my goals in doing these episodes is to discuss your educational experiences and give prospective students a glimpse of what going to the Samuel Merritt University College of Podiatric Medicine is like. So to get started, Miko, perhaps you could share with our listeners what podiatric medicine is.
So podiatric medicine is a medical and surgical specialty that focuses on the foot and ankle. How I think about it is basically everything below the knee. We are an expert at, and we treat all different pathologies below the knee. So that is what podiatric medicine is.
Very good. And Dayron, would you please share with our audience the educational pathway to becoming a podiatric physician?
Of course, yes. So podiatry follows a pretty standard model similar to other medical programs. It would be the 4-4-3, 4 years of undergraduate school, 4 years of graduate medical school, and then a 3-year surgical residency. And that undergraduate period could be in any specialty, any major, as long as you fulfill all of your prerequisite and your basic sciences classes, anatomy, all those science classes.
Yeah, I always say the physics and or chemistries get people, right? And then, of course, there's always an opportunity to do fellowships also. So 4-4-3 and then potentially a fellowship. So that's the pathway. Thank you so much, Dayron. So to set the stage for our discussion today, I was hoping each of you could share your podiatric journey to date, perhaps where you're from, where you went to undergrad, how you found out about podiatric medicine, and how you decided upon attending the Samuel Merritt University College of Podiatric Medicine. Why don't we start with our soon-to-be graduate, Raisa? Raisa, would you share your journey with us?
Yeah, of course. So everything started in my native country, Peru. I'm from Peru, very proud to be from South America and represent my heritage. I immigrated to the United States 12 years ago. I've always wanted to become a physician, but because of lack of resources, I could not fulfill my dream in my country. So I came here, started working really hard in multiple jobs, and went into undergrad. First, I did community college. I did a couple of community colleges, so Contra Costa College, one of them where I met my best friend and now future colleague, Miko. I also attended Las Positas College, and then I transferred to San Jose State University, where I got my major in global studies with a concentration in human rights. After that, I worked a little bit, about 2 years or so, to save up enough money to apply. As we all know, it's challenging applying to medical school, in this case, podiatric medical school. And after that, I got into Samuel Merritt. Now I decided to stay because my whole family is in the Bay Area, including my mother. And that was a key point for me to stay close home, to my support system. And how I discovered podiatric medicine was after taking the MCAT. I was going through many different possibilities in the medical field. And when I discovered podiatry, I remember vividly, I got really happy because there's so many things within the field that you can do, from biomechanics, surgery, clinics, and everybody has a niche for it. So I thought I could do really well. And that specialty so far has been the best decision of my life.
Well, that's an excellent story. It's quite a journey you've been on, Raisa.
Thank you.
Miko, would you share with us your podiatric medicine experience to date?
Sure. So I grew up actually as a ballet dancer, and I trained really hard every single day as a teenager and as a young adult to become a professional ballet dancer, which I did become. I was part of the Birmingham Royal Ballet in the UK. Unfortunately, I suffered from some foot injuries myself. I broke my second metatarsal. I had Lis Frank dislocations and other injuries as well in my feet. And that plus a few other components led me to want to go into the health field. And so I had to start from ground zero because I actually did not go to high school. I just did kind of an online version. And then so I started at community college as well, where I met Raisa. And I have to say, Raisa is a huge point of inspiration for me in this whole story because she's the one that introduced podiatry to me. And so the fact that she's still a huge part of and as also being my best friend. So she's really who introduced podiatry to me and got me interested, especially with my past and my own injuries growing up. And so once I found out about podiatry from Raisa, I was like, this sounds like the perfect career for me with all the different specializations within podiatry that I could choose. And so kind of same reason I went to Samuel Merritt because my family's from the area and my best friend's from the area. And yeah, really Raisa is such a big inspiration for me personally. And she's been killing it this whole time. And she just recently had a baby as well and still going through everything and succeeding. So I'm just so proud of her. And yeah, I just wanted to give a little shout out.
Well, it's great to have a support system. And Raisa, congratulations on the baby.
Thank you.
That's fabulous. All right, we'll circle back around with some more stories. So let's move to the two representatives from the class of 2026. You both just finished your first year. Nicolette, would you share your journey in podiatric medicine so far?
Yes, thank you. So I'm also a Bay Area native. I unknowingly started my podiatric journey, I would say, in high school. I was part of the athletic training program they offered. I did it for 3 years, really learned about the body, was taping all the athletes, was helping the trainer on and off the field. And it was a big reason I chose kinesiology as my major at Cal State University Fullerton in SoCal. Still was trying to figure out the perfect kind of career to move forward in. And my dad actually showed me podiatric medicine and was like, look, there's a whole career about the foot and ankle. And I'm like, well, I was the best at ankle taping. Like, how perfect for me to find what I felt more comfortable in and felt like I could do for the rest of my life as a career. So it was like perfect match for me. And I've loved every second of it, learning from all the doctors. Right after I shadowed and got in, I was like, okay, this is the path to go. This was the right decision for me. So,
very good story. Thank you. And Dayron, can you share with us your story on your journey in podiatric medicine to date?
Sure. So similar to Raisa, I actually immigrated to this country when I was 5 years old. I came from a country called Cuba, so there's not a lot of opportunities there for many, but my parents made the decision to bring me over, and it was the best decision that they've ever made. From there, I knew that I had to work hard, and I wasn't sure what I wanted to do yet, but through high school and through my academic career, I knew if I just dedicated myself to my studies that I would find a field later on down the line. And so when I finally got into college, I knew that healthcare was the field and the profession that I wanted to do, but I wasn't sure what healthcare position, PA, doc, MD, DPM, dentist. There were so many options. I felt kind of lost. But I looked around the area and I shadowed several different specialties. And once I shadowed Dr. Silvestri, big shout out to him in Endicott, New York, he made me fall in love with podiatry and what it can do for the community. So ever since then, I'm locked in.
That's a nice segue into talking about shadowing, Dayron. Thank you. Was shadowing for each of you a significant portion of your decision to go into podiatric medicine? Raisa, I'll start with you.
So in the beginning, since I didn't know much about the field, I applied. But after I did have the opportunity to meet this amazing podiatrist called Dr. Colleen Kenny in the Bay Area, she became my mentor and my biggest inspiration in the field. And ever since, I started working at her office as a medical assistant, and then little by little, as my education progressed, I learned and I continue learning from her so much that, yes, I'll say shadowing a podiatrist has been fundamental for my career.
Very good. Thank you. And Nicolette, you had mentioned you had done some shadowing. Any shout outs to doctors that you had an opportunity to visit with?
Yes, I did a few in Southern California. I would say the biggest thing is to go and shadow as many podiatrists as you can, because you learn so much from each one and the type of way they run their clinic, or maybe some let you see surgeries that others don't. So I'd say that's a very big part of why I chose mine, yes.
Very good. And Miko, how was your shadowing experience? I know you're following in the footsteps of Raisa, but did you get to shadow also?
Yes, I definitely wanted to shadow before I started because, when you're starting podiatry school, it is a big investment, both with your time and your money. So you really, should be pretty sure that this is something you want to go into before you start. And so I definitely shadowed at, it's called Bay Area Foot Clinic here in the Bay Area. And I went multiple times a week just to see if I could see myself in that kind of position. And once I did go, it not only could I see that I could definitely see myself doing something like this, but it also answered a lot of the questions I had about what the pathologies that podiatrists could treat. So definitely recommend shadowing for sure.
That makes sense. So often our students come into the profession and it's that shadowing experience that was the tipping point, because most podiatrists are kind of enabling their practice to be what they like it to be. So they're always happy in practice. So I think that's important. Dayron, I was just going to make a comment. We have a colleague in Miami, Florida, Mario Cala from Cuba. He was a dentist in Cuba, and he came and became a podiatric physician, and I'll connect you with him. You would really enjoy talking with him also, I'm sure. Very good. So the next question I have for you, I commend all of you on being leaders within your classes. I know that it's a lot of work on top of the curriculum to be a leader with APMSA. I was wondering if each of you could talk about how you got involved with APMSA and what your current responsibilities are within the American Podiatric Medical Students Association. And again, I'll start Raisa with you.
All right. So as a fourth year, right now, I, of course, represent my class, the class of 2024 at a national level. We are in charge of overseeing also the rest of the classes. So, 2023, 2022, 2021. Also, we hear and transmit what the students at our schools questions, concerns about different things, starting from boards and updates, and we relate that to the organizations that we work in the podiatry field. So it could be our board organizations, MBPME, the APMA itself. We hear also what is going on, and we talk and report back every semester as a cohesive unit, and report what's going on around the country to our classes.
Very good. And Miko, for the class of 2025, what has your role been with APMSA?
For me, it's very similar to Raisa's, and I think very important for my class is the boards that we just took. So any issues that my class had with taking the APMLE, I relayed that to the members of the NBPME, the National Board of Podiatric Medical Examiners, so that they hear the voices of the students and incorporate that for the upcoming exams, or any feedback that they got about questions or how the experience was for the students, because that is important so they can improve and make it better for the upcoming classes. So that was like a big responsibility for me, especially this year as the kind of third year delegate.
Very good. Thank you. And then Nicolette, how about your experience with APMSA and what are your current responsibilities?
Right. So as a first, second year kind of student into the transition, we take notes on everything fully discussed in the board meetings, and we're in charge of relaying all that information back to the class. And as someone being new to APMSA and learning about all the responsibilities and discussions we have, it was a really great way to fully dive deeply into like every nick and cranny of how much we really do talk about, the profession and the future of podiatric medicine and the connection with the already, the board of certified doctors and everyone. So,
very good. Thank you. And Dayron.
Yes. Firstly, I just want to say thank you to Miko for her orientation presentation, which is definitely what got me interested in APMSA. She showed me how much representation matters for a field like this. And so when I went into APMSA, advocacy was a big topic on my mind. And so I was able to join the legislative committee within the APMSA and eventually get the legislative committee liaison role to the American Podiatric Medical Association, which sponsors legislation and bills and talks to politicians at Washington in regards to the field, the students, and everything that we could do to advance the field. So I'm very excited.
That's great. And from an outsider's perspective, I see the four of you, and I think our profession's in great hands moving forward. So thank you for your efforts on behalf of not only your college, but for the profession as a whole. Thank you very much. All right, let's shift gears a little bit. Let's talk about the educational experience at Samuel Merritt University College of Podiatric Medicine. That's not quite rolling off my tongue yet. I'm a graduate of the California College of Podiatric Medicine. I went back when the school was in San Francisco. So whenever I think of the Bay Area, those were four of the greatest years of our lives. My wife and I were married at the time. So I always have a warm spot for Samuel Merritt University. So let's talk about that first year. Nicolette, do you want to talk about the academics in the first year? And then Dayron, when Nicolette's done, you can add if you want.
Yeah, thank you for sharing that. That's so great that you went to the same school, different school, at the same school, right? So in the first year, I would say, for any first year, it can be quite overwhelming to adjust to all the new classes, maybe the course load. Like I certainly haven't taken that many units in one semester at a time. So it is quite an adjustment, but I would say what I noticed heavily at Samuel Merritt is all the support you have from your classmates and each class above you. You're given a mentor from each class who you can go to for advice whenever you feel like you're struggling, or maybe some notes, a new perspective on the courses. Because it was also my first time taking things like biochemistry and some of the other science courses as well. And some people majored in those classes where I am just a newbie and I'm like, I have to take all these exams for this course I don't know. So the support was amazing at our first year, and, really joining all the clubs and getting to know Oakland as well. Not everyone's around familiar with the area. So just bonding with everyone and trying out new places. I would say those are the biggest highlights of my first year experience. But whatever, Dayron, feel free to add. I'm sure you can add more. So,
absolutely. So I definitely agree that the support within our class has been amazing. If anybody ever feels like they need help with something, we have a group chat where we just message out, and almost within minutes you have 10 study guides, Anki flashcards, whatever you need from from our students, and definitely want to thank the faculty as well. I know myself, I'm a first generation college graduate. I'm still working out on, getting to be as book smart as I can be and the study procedures. So we have academic resources for students. We have faculty who is willing to meet with you for office hours multiple times a week, and they've all been incredibly helpful.
So a question for each of you. What was the most difficult course you had your first year? Dayron.
For me, that would definitely be biochemistry. Followed me right along from undergraduate. Anything with chemistry in the name typically gets me. That's the one.
Nicolette, how about you?
Honestly, the first one that comes to mind is human anatomy, but purely for the cadaver room. It wasn't my favorite, but I do feel so blessed for that experience. It taught me so much, but I just am not a deaf person. And in podiatry, patients aren't dying right in front of us. So that's something that was a little bit hard for me to deal with, but learned so much.
I feel like I'm talking to my students in Arizona because they would echo your sentiments with biochemistry and anatomy. No doubt about that. Well, thank you so much. Miko, would you discuss the second year curriculum at Samuel Merritt University?
Sure. So in second year, you start more rotations. So clinical rotations at our school, we start. So Mondays and Fridays, we start clinical rotations, whether that's at a clinic or a hospital or in the classroom, but working on clinical skills. And then Tuesday through Thursday, you have your classes. And I would say second year is pretty tough in terms of the workload. Like you do have to study a lot and you have a lot of exams. But again, our school is great at making sure that you have the support you need in terms of academics, and professors reach out to you if you're struggling. And so it is definitely possible to get through it. But second year was definitely not easy for me. I would say for me, the hardest course for second year was probably pharmacology. There's so many drugs and so many mechanisms of actions and so many adverse reactions that could occur. So it's just keeping that all in my head was sometimes hard, but enjoyable at the same time because our pharmacology professor is so cool.
Oh, that's great. I think that's one of the questions I always get from students are, what do you do to help us prepare for boards outside of just the curriculum? How do they help you prepare for boards at Samuel Merritt?
So in our spring semester, we have a whole course just to prepare us for boards. So every week we go through practice questions, and each week is a different subject. So I think for 2 weeks at a time, we had human anatomy. Next 2 weeks, we had biochem. Next 2 weeks, we had a different subject. And each week we'd go through questions together and go through the answers and start getting our minds a little bit more ready for boards. And then our school does give us a pretty good amount of time after finals to study for boards. So I think we finished like late April. So we had May and June to study. So that was quite a lot of time of just dedicated study time with no classes. Some of us had May rotations, but most of us also didn't have May rotations. So that was also really helpful. And then again, just making sure you learn it well the first time. Like don't just, try to skim and not really learn the subject when you're learning it in your class. If you learn it really well the first time, then reviewing it will be so much easier.
Well, those are words of wisdom. I like that. Thank you, Miko. Raisa, what's it like at Samuel Merritt University College of Podiatric Medicine when you pass boards and you start your third year rotations, and then you're now currently in your fourth year? If you wouldn't mind reviewing those 2 academic years for us, that'd be great.
Yeah, of course. So during your third year, you have most of your time at hospitals all over the Bay Area, or in a school, we have clinical skills rotations as well. So 1 month at a time or 2 months, depending on the rotation. So vascular, for example, is combined with diabetic. You do 2 months of that at institutions such as the VA San Francisco or UCSF, or both, which is really beneficial for students. I think San Francisco General Hospital and so on. And only one day during your third year, which is Thursdays, you have your classes. So it feels like a reward after those tough 2 years that we just hear from Nicolette, Dayron, and Miko. So you feel happier. To me, those were my most joyful times at the clinic. So, as I said, one day you do many classes, including dermatology, Finnish jurisprudence, biomechanics, podiatric surgery, and podiatric trauma. Those are the last courses you have. And afterwards, during your fourth year, you start your clerkship. So no many students are familiar with it, but now that I'm going through it, I think I can explain a little better. So bear with me. So first, during your fourth year, previously you have applied to what's going to be your core. Your core is going to be based your 4 or 5 months of your fourth year where you're going to stay. If you want to stay in the Bay Area, San Francisco Bay Area, all the North Bay, you can choose to stay. You don't need to do anything else, just transition into your fourth year. Now there are other 2 opportunities that you can take, which is do your core months at the VA Albuquerque, which is what I did. You have to apply. It's like a pre-residency application, a little bit of the warm-up for residency interviews in the future. Or you can do Puget Sound Hospital, and that's in the Portland area, Oregon. So you do 4 to 5 months there. The rest of months, you have the opportunity to go to different hospitals around the country if you would like to, and see where would you like to be for the next 3 years of application for residency programs. So in my case, I applied because I wanted to see the United States. I'm always a tourist. So I wanted to see how it was podiatry all over the country and different also areas. So I did Albuquerque. Now I am in Rhode Island, currently the Providence area, which I'm enjoying a lot right now. Next month, I'll be in Phoenix, Denver, and I close the year in Miami. Afterwards, apply for residency, and then I finish my core in Albuquerque because they give you the opportunity for 2024 before you graduate, and I'm going to finish my core in Albuquerque.
Very good. Thank you. That was very descriptive. And are you having fun on clerkships?
Oh, I'm having so much fun. It's a lot of surgery, a lot of opportunities, getting to know new people and new students. And more so, I feel more prepared as the months go. Questions keep repeating and you become a stronger applicant as you go. So I highly recommend the fourth year. Is really fun.
Very good. So something I've been doing with the other colleges is professor shout outs. Could you each say a professor what course they taught and why you enjoyed their course so much? Miko.
Yeah, for me, I want to give a big shout out to Dr. Richie. She taught this podiatric surgery course at our school. So I took podiatric surgery 1 and 2 and some radiology courses as well. And she is just such an amazing professor. I really loved how enthusiastic she was about teaching. Like you could tell she's really passionate about surgery, and she really does a great job at explaining surgeries. Even though it is hard on a PowerPoint to explain it, I think she did the best that she could. And I like professors that are organized and organize their presentations really well. And I found her presentations very organized. And yeah, I just loved her personality too. Like it made me so excited for surgery. Unfortunately, she's not going to continue teaching at Samuel Merritt anymore. I think she's going to be moving to the Arizona school. And so I'm excited for the students in Arizona to be able to experience her amazing teaching.
Thank you very much. And I know Dr. Richie, and she is joining us in Arizona, and students love her. And I think she's got a CME program coming up this week. I think Samuel Merritt students are going to be involved and our Arizona students. So the cool thing about our profession is it's small and you'll always be able to still connect with Dr. Richie. So that's great. Nicolette, professor shout out.
For the same course that I talked about earlier, human anatomy, but I want to give a shout out to Dr. Legleiter because she really is the sweetest. With so much going on in the body, she simplifies it for us and helps us get it even more with all the maps, all the tools, all the studying tools to give us. And she was amazing. And one more shout out, as second years at Samuel Merritt, we're able to go to clinic already. So shout out to Dr. Splitter at Highlands Hospital. She was the best mentor and just is so calming as like such a nervous second year going to my first clinical rotation. So she stood out to me a lot and was a really great doctor. So.
Well, that's great. Dayron.
Awesome. So I would definitely shout out Dr. Legleiter as well, and also Dr. Lanier. She was our biochemistry professor for the first year, and she actually was able to help us out in such a greater capacity than she was even instructed to do so from the beginning. She was an instrumental part for us, not only in biochemistry, but fulfilling a portion of our physiology course as well. So huge shout out to Dr. Lanier.
Fantastic. And Raisa.
I wanted to shout out to a professor that's now retired, Dr. Carol Gilson. My class was the last class she taught physiology and histology. And even though it was a very hard course for probably 99% of the class, she cared a lot about students, including after the first exams, she will have a group of students that did not perform as well as she wanted to, and she will create groups for the weekends, Saturday and Sundays tutoring personally from her home. Wow. To make sure students learn. So shout out to Dr. Gilson. I hope you're listening to this podcast. And also one more to Dr. Sanchez. Such an enthusiastic professor. I think pathology is hard for everyone, but he has so much passion for teaching and love for students. So thank you.
That's great. And I can tell you all agree because whenever each of you said a name, everybody else was nodding yes. So that's fabulous. So I've had an opportunity to work with Dr. Stamps a lot over the years, and I've known him for a long time. He's just a great dean. And just a little interesting story. When I came up to visit the California College of Podiatric Medicine before I started, it was Dr. Sherry Choate that was the student ambassador that gave me my first tour of the college. And so she's phenomenal too. So you've got just some tremendous leaders up there. So one of the last questions I'd like to ask you is, what do you all do for fun? You know, there's a, excuse me, there's a lot of stress, there's a lot of information, there's a lot of exams. What do you do to recharge the battery personally and as a class? Miko.
For me, I need to get better at balancing. I think balancing life and rest and school is always something I will have to balance really well. But for me, I really love teaching ballet. So on the weekends, it's a way to keep connected with my past as well as a ballet dancer. And so I love teaching students, like students getting ready for international ballet competitions. I really enjoy teaching them on the weekends, and it helps me with my mindset as well for the week. But then when I do actually want to rest, I like going out to dinners with friends, getting some good food. That's how Raisa and I also connected. We always loved getting pho together. And so, yeah, eating good food and teaching ballet is how I kind of recharge for the week.
Very good. Yeah, there's no shortage of good food in the Bay Area, that's for sure. Nicolette, how do you relax and recharge the battery after exams?
Well, as a class, sometimes we'll go out and get lunch, or just after a big week of finals or something, we'll go out together and get food, which is nice. But solo, I'll just go to the gym. And recently I've been trying to study in the sun. I will just go to the pool. Sometimes I've been there for too long and I'm burning up, but I just got to get my study guide done and then I'll go home. And it just makes the balance a little bit easier when you're out somewhere, nice, or just at a coffee shop, or that's my balance. So.
Dayron.
So I'm new to the Bay Area, so every time I have a little bit of free time, me and the wife, we go out, we do all the tourist spots. Last week I had a procedure done, but just before that, we were out in Golden Gate Park, and we got to see the Japanese tea house. It was really, really fun.
That's great. I used to run in Golden Gate Park every day when I was in school there. It's so beautiful, all the way down to the ocean. It was just gorgeous. So, Raisa, I have a question for you. Not only how do you relax, but how do you balance the baby? Because we've got students at our school right now that have very, very small children. And I'm sure that prospective students coming into Samuel Merritt would be interested in that.
Yeah, so I think before having the baby, I made sure that I had a very strong support system. I think from the perspective of the mom and woman, right, in medicine, we do have demanding careers, but also we have a demanding little baby at home. So my fiance, he's a tremendous support for me and the baby. He stays with her whenever I need to be at the hospital or I need to study. For the first 3 months, it was time for finals for my third year. So between my mom and mother-in-law and my fiance, they took care of baby. Some days even somebody drove me. They waited in the parking lot with the baby until I finished the class because she was probably like 8 or 7 weeks old. It was very little. So just having that support is so important. I do make sure that in my case, I chose the breastfeeding path, a little harder for many. But I think after the whole biochemistry class, it just got into my brain the benefits of breastfeeding in general. So I decided to go that route. It's okay if you don't, that's okay too. But in my case, I pump before leaving the house. I leave plenty of milk, make sure I'm hydrated through the day. I do take my pumps with you. With you, and with me everywhere I go. So make sure that I don't also get mastitis of any time. Mm-hmm.
Congratulations. That's a lot of juggling. I know that for sure. So well done.
Thank you.
Well, the last question I'd like to ask you is, what would you tell a prospective student that's considering podiatry about the profession? And secondly, what would you tell them about Samuel Merritt University College of Podiatric Medicine? Dayron.
So the first thing that I would tell them is to go out and shadow, learn as much as you can, see it in person. That's definitely what did it for me, just seeing the impact that even just an orthotic or a shoe insert can have on somebody's life after several weeks of using it. Definitely recommend that. And then as far as Samuel Merritt, I would say it's an amazing school, lots of great faculty. If you ever need anything from any of the teachers, just reach out. Such a close-knit community. I feel like almost everybody in the class is just one big group of friends. We all help each other. Awesome experience.
Very good. Nicolette.
I think definitely remember your why you want to be a physician, why you want to go into healthcare at all, and think about the lifestyle that podiatry offers and ask all the physicians you shadow about the benefits of podiatry, not only for you, but for all the patients you're going to see. And in terms of Samuel Merritt, we really offer there's so much diversity in the Bay Area as it is, that I think going to school here and getting to explore that, where maybe you live in an area that's not as diverse, could really open a lot of doors for you as a student and as a future physician.
Very nice. Thank you. Miko.
I would say that podiatry is such a great field. I feel like it's not hard to find something in this field that you will enjoy, whether if you really like treating diabetic wounds or the more surgical aspect, or if you are someone that really loves sports and wants to do sports medicine. Or pediatrics. We have so many kids and babies that need pediatric foot care too, with club foot and everything. So I think as long as you have shadowed and you can see yourself in this field, as Dayron said, try to keep your hopes up. It's like the first 2 years are not easy, but there is something for you to find in this field that you will enjoy. And you can really pick and choose. Once you've passed residency, you can kind of pick and choose what you want to do and what you enjoy doing. And then in terms of Samuel Merritt, Nicolette and Dayron really put it well that, the community is strong at our school. The class sizes, I think we have one of the smallest class sizes in the country. So that really helps students bond and help each other out. Just love the Bay. The weather is great here. It doesn't get too cold or too hot. And the food is great here. So definitely love the Bay Area.
That's great. And, I always tell my students, those first 2 years are hard, but if it wasn't hard, anybody could do it, right? So
that's true.
Absolutely. Raisa, what would you tell a prospective student coming into the field and also about Samuel Merritt University College of Podiatric Medicine?
Yeah, I would tell them welcome to one of the best fields medicine has to offer. Not many people talk about it, but we are here to tell you that it's an incredible opportunity to help your community, to make a difference in patients from all ages and backgrounds, and do what you really want to do. What's your goal? Once you commit, and that's the thing, right? Once you commit, you're in 100%, just keep going, be determined, and keep living life. That will be, as a fourth year, my biggest advice. Don't put your personal life on hold. Enjoy as well. Work hard, study, but find and try your best to find that balance. In my case, I remember every Tuesday, my husband and I, or my fiance and I, we were going to the movies. And we made sure, even if it was late, like 8 p.m., 9 p.m. showing, and I was falling asleep in the movie theater, we had a popcorn, and that helped so much to just, stay present. I decided to have my family. And so if people are trying to plan their families, don't think that it's impossible, because it is. Everything with determination, with courage, passion. You are in a great field, and we are only growing, and we're only discovering new ways for our field. So welcome.
Well said. Very, very nice. Well, I commend all four of you on your journey. And again, thank you for being leaders in not only in your particular school, Samuel Merritt, but in the profession. And to our listeners, if you're listening on Apple Podcasts or Spotify, please give us a 5-star rating. And of course, if you're on YouTube, please become a subscriber. I think everybody will love this episode. Thank you so much for sharing your experiences at Samuel Merritt University College of Podiatric Medicine. I will be sending each of you one of these little Dean's Chat cups so you can drink coffee or tea or your beverage of choice. And until next week, we'll have another college, school or college of podiatric medicine. Cheers, everybody.